Okay, the first thing you would do before meeting your patient is to make sure you have your PPE on. That includes gloves and mask. So after the dividers has been set up, we are going to sanitize the beds and set up the patient beds. And you would place the bed lining on the top. So this bed should be ready to see the next patient. So as part of the intake, you want to make sure that you have the proper equipment to measure the vitals. This includes a blood pressure cuff, a pulse ox, as well as a glucometer. In the glucometer, make sure that you're stocked with the machine, the test strips that goes with it, the lens set, an alcohol prep pad, and a Band-Aid. Okay, I just got a message saying patient is ready for intake, and now I'm gonna head to the reception to take the patient. Hi reception, I'm ready for the patient.
Awesome. All right, Claire, this is Joy. She'll be your intake volunteer today, and then Joy, this is Claire.
Hi Claire, my name is Joy, and I will be taking you to the intake room. Okay. Please follow me. Okay. So my name is Joy. I'm gonna be your undergrad volunteer for the clinic. I'm gonna be here to answer any non-medical concerns as well as explaining the flow of the clinic to you. Okay, now I'm just gonna have you seated in our intake room to get your vitals taken.
Okay, sounds good. I'm very excited to finally be able to see a doctor.
Yeah, the medical student should be able to see you shortly. Meanwhile, please take a seat over there.
Okay.
Hi Claire, so what brings you in today to our clinic?
Yeah, so I'm thinking about getting a medication refill. I have a history of hypertension. I haven't seen the doctor for a while, so I'm thinking about just doing like a general physical checkup.
Okay.
And then these past couple days, I've been feeling like really dizzy, so I'm wanting to get that checked out as well.
Yeah, no problem. I'll make sure I note that and address your concerns to the medical students. So for this part, I'm gonna be taking your blood pressure. Is it okay if I see your left hand?
Yeah.
Can I have you roll the seat?
Oh.
Okay, meanwhile, I'll have you rest your elbow while I take the blood pressure. And can I also see your right hand for oxygen? Let me take that off you. I'm on chart. Okay, so now I'm gonna be taking your heart rate. Can I also see your left wrist as well?
Mm-hmm.
Thank you. And are you comfortable with providing me with your height and weight?
Mm-hmm.
Okay. So that concludes our intake part. Could you please follow me to our patient room?
Mm-hmm.
Please take a seat on the bed. I'm gonna go consult the medical student. I'll be back shortly.
Thank you.
Now the patient is placed in the room. Please make sure to flip the sign to indicate that the room is occupied. Now we're gonna head to the preceptor room for the medical student. Before approaching a med student, we're gonna update the status on the board. So this is where we would note down the patient's information. Make sure that the room number is correct. Note their name, their PRN, the undergrad, which in this case it's myself, the chief complaint, insurance status, as well as if they are FSC residents. Also put down their status in clinic, whether they're in room, they have been seen by a medical student, or they've been seen by a preceptor, or they're waiting on their medication. Please make sure to also note if they are qualified or interested in any of our specialty clinic. This includes our BHT, our DSG, smoking cessation, dental, OB-GYN, or ophthalmology. Put down their PRN if they're interested, and make sure to contact the co-head for their appointments. Now I'm gonna approach a medical student. Is anyone here available for a patient?
Yeah, I'm available.
Okay. Hi, my name is Joy and I'm the intake person. So we have a patient named John Doe. He's a 43 years old male. He's complaining about dizziness. He also would like his medication to be refilled as well as getting a general checkup. So his vitals are listed. His height is 6'2", weighing 162 pounds, temperature 97.9, blood pressure 116/72, heart rate is 79, respiration 16, and his O2 is 99. Do you have any questions for me?
No, is the patient ready to be seen right now?
Yes, I can show you where the patient is.
Okay, let's go. Hi, can I come in?
Yes.
Before heading in for shadowing, please make sure to get consent from the patient to shadow. And during shadowing, please make sure to gather any supplies medical student might need or any concerns they may have.
During the medical student's visit, a thorough history will be obtained and a physical assessment will be performed. Be ready to gather any diagnostic equipment medical students request.
Here we will take your lung sounds, if that's okay with you. So breathe.
After a medical student's visit, the case will be taken to the preceptor who will discuss and develop treatment plans for the patient. If no preceptor is available, regular check-in on the patient and offering snacks or water during downtime is highly encouraged. After the discussion, the preceptor will visit the patient with the medical student.
Okay, let's go. Are you ready? Yeah, let's do that. Yeah.
Hi, my name is Anshul. I'll be your preceptor today.
During preceptor's visit, the doctor will address patient's concern and perform procedures that's necessary to conclude the patient's visit. Be ready to assist with the procedure upon preceptor's request.
Towards the end of the clinic, we're going to be filling out a post-visit summary. During post-visit summary, you will be consulting a medical student for directions. So we have a patient already fill out like their name, their reason for visit, and as well as their vitals. And these are all the resources that we refer them to. We'll make sure that we relay that to our patient, as well as our specialty clinic that we refer our patient to. So would you please fill out the medication dosage and the direction you use?
Sure, let me just look back at practice fusion. Here you go.
Okay, thank you. I'll be handing this and as well as the resource and the medication to the patient.
Okay.
Thank you.
Thank you.
So towards the end of the clinic, after we have acquired the post-visit summary, the social referral services will have compiled, as well as patient medication, we're ready to send the patient off. Hi Claire.
Hello.
So thank you for your patience. So we already have your medication ready.
Thank you.
And this is the post-visit summary that has the instruction as well as the specialty clinic that we refer you to.
Thank you.
And these are the social services that you requested, including clothing and food assistance, and it has direction to the resources as well.
Amazing.
Yeah, thank you for your visit. I'm gonna walk you towards the reception if that's okay.
Okay, perfect. I love coming to Willow Clinic.
Yeah,
everyone here is so nice.
Thank you. So after the patient have left, we're gonna reset the room to be ready to see the next patient. So I'm gonna start by placing the bed liner. We're gonna sanitize and wipe down the bed. And then we're gonna replace the bed liner on the top. Finish resetting the room, and we're gonna walk out and making sure that the sign is flipped to the green side to make sure we are ready to see the next patient, as well as erase any patient information on the whiteboard.